Hi, my name is Michelle. I'll be your student nurse today.
Hi.
I see that I've checked your vitals here, so your temperature looks good at 36.5. Your pulse is 80, and your respiratories are good at 16. Your blood pressure is perfect at 120 over 80, and your oxygen is 98%. And I just washed my hands and introduced myself and verified your identity, and you seem alert and orientated. So I'll start with your respiratory assessment.
Perfect.
That's good.
Sounds good.
All right, so a few history questions. Have you been experiencing any shortness of breath?
No.
Okay. And any wheezing at all?
Nope, no wheezing.
No wheezing. And have you had a history of chest tightness or any pain?
No, not really, no.
Okay. And have you had a chronic cough?
No, I don't have a cough at all.
No, not a cough. Okay, and so there's no sputum being coughed up at
Nope.
all for a productive cough? No. Okay. And do you have any allergies?
No, just seasonal allergies, that's about it.
Okay. And have you had any experiences with tuberculosis or asthma?
No, I haven't.
Okay. And have you had the flu vaccine this year?
Yes, I have.
Perfect. And are there any environmental conditions at home or at work that might affect your respiratory health?
No, not really anything other than maybe a little bit of dust.
Dust, okay.
Yeah.
So no coal or asbestos or anything like
nothing
that.
like that. No, nothing.
Perfect. And have you ever smoked or do you smoke?
No, I don't. I never have.
Do you think you would be exposed to any secondhand smoke?
No, not really. No, I'm not really around anyone who smokes.
Okay. And do you have any family history of lung cancer or any respiratory diseases?
No, nothing like that, no.
Okay. All right. And so I'm just going to do more of a physical assessment of your respiratory tract. So
Okay.
I'm just going to have you lay down on this pillow here. Awesome. So I'm just looking at your chest wall, see if it's symmetrical, and just your movement up and down. I'll just put your arms at the side. Great. Awesome. And so I'm observing your breathing for rate and quality. So, so first I think I'll just inspect the skin and nails for integrity and color. So it seems like you're getting adequate oxygen to your hands there, and your skin on your face. That's good. Okay. And so I'm just going to inspect your neck here to see where your trachea is at. It seems pretty symmetrical, proper positioning. And so I'm just going to palpate your chest quickly to see if there's like any tenderness at all.
Okay.
Does that feel okay?
Yeah, I don't feel any
Nothing
tenderness.
there?
Feels okay.
Good. Okay. Yes, ticklish as well. Awesome. So I have no reason to believe you have any fluid in your lungs since you haven't had any problems with that in the past. So I'll just get you to sit up back again with your feet on the end. And I'm just going to listen to some of your lung sounds.
Sure.
So doing the front here, just take a deep breath for me. Good. And again. Great. And then in the back here. Great. And once more. Alright, and I'm just going to do laterally as well, just on the side here. One deep breath. Good. And once more. Great. Awesome. Okay, so, looks good. So then I'm just going to move on to a cardio assessment as well. So I have some questions for that.
Sure.
So have you been experiencing any chest pain?
No.
No. And do you have any shortness of breath?
No shortness of breath, no.
Okay. And have you noticed any swelling or edema in your arms or legs?
No.
And do you have any leg pain when you exercise?
No, I'm fine when I exercise.
Yeah, okay. And have you found that you tire easily in general or after you've exercised?
No, I feel like I'm pretty good with energy.
So if you rate fatigue on a scale of 0 to 10, 0 being no fatigue?
Probably, yeah, like maybe like 1 sometimes if I don't sleep enough the night before. Yeah.
Okay, sounds good. And how often do you void? Do you void frequently during the night?
No, usually just before I go to bed, and then I just in the morning when I wake up.
Okay.
I don't really wake up during the night.
Yes, okay. And have you noticed any heart palpitations?
No.
No? Okay. And do you find that your skin ever turns pale or blue that you've noticed?
No, not really, no.
Okay. And do you have a family history of heart disease or any high blood pressure, diabetes?
No.
Okay.
No.
Good. And what would you say your alcohol consumption level is?
Just socially, so occasionally, not on a regular basis.
Okay, so 1 to 2 a week?
Yeah, like once a week or maybe once every couple weeks.
Okay.
Yeah.
Good. And what is your physical activity like?
I try to exercise usually like at least a few times a week, like at least 3 to 4 times.
Okay. And are you taking any heart medications at this time?
No.
Okay. And would you say that you participate in any activities that would put you at risk for any infections like HIV or hepatitis?
No.
Okay.
No.
Awesome. Okay, well then I'll move on to another physical assessment just
Okay.
of your heart there.
Sounds good.
So for this, I'm going to have you lie down actually again,
Okay.
if you don't mind. Great. So I'm just going to do a quick head to toe
Okay.
of just like your general color and your skin, your mucous membrane. So can you open your mouth just to check your gums? That looks good. Good color. And your skin looks good. I'm just going to palpate down to check out your temperature, your color, and look at your pulses as well. Okay?
Sounds good.
So, color looks good. And nice and warm, that's good. Cap refill is good on this end. I'm gonna go on the other side. Good. And color's good. Nice cap refill. And is it okay if I take off your shoes?
Oh, sure. Yeah.
Good. Perfect. Filling down, good color. Nice cap refill. Toes are a little cold, but it is November. Awesome. And what else we have? So I've checked your pulses and your skin color, your temperature, and your cap refills. Your pulses do look symmetrical with good quality.
Okay.
And so I'm just going to listen to your heart a little bit while you're lying down there, just to check out the rate, rhythms, and sounds.
Okay.
See if I can hear any murmurs. So I'm just going to go on the left side here. Sounds pretty regular, equal rate, and good sounds. So
Okay.
that concludes my cardiovascular assessment as well. So
Perfect.
do you have any more questions for me while you
No,
wait?
I think I'm good.
Okay, great. Well, there'll be somebody to see you in a couple of minutes then.
Sure.
Thank you very much.
Thanks.